Peace be upon everyone. Alhamdulillah, we have started that program on parenting. Today is our second session. So we have our experts with us, Dr. Habiba and Dr. Najeeb. We are going to discuss the second question that majority of the parents want to consider when they talk about parenting. So let's look at the question that we have for today's discussion. So on today's discussion, the question we have is how should parents handle children's resistance and defiances such as morning routines, bedtime routines, fussy eaters, refusal to take responsibilities, refusal to do chores, refusal to participate in family activities, and refusal to cooperate in general. So this is a very common problems for majority of the parents. Doesn't matter how experienced a parents. I can tell my, I have 4 kids. We are married for over 22 years. We still have same problems. So we really need guidance from pediatricians like Dr. Habiba and psychiatrists like Dr. Najeeb to navigate this kind of challenging situation so that we can successfully do our parenting correctly. So, Dr. Habiba, please go ahead. You start.
Can you put that question? You had asked so many things. So let's go.
Yes, we can do that. And I'm going to share the questions. So, if you can see it, please, the second question, number 2. Are you able to see?
Yes. So,
Oh,
okay. How should parents handle children's resistance and defiances,
mm,
such as morning routines, bedtime routines, fussy eaters? Okay. So let's first, morning routines. So we can talk about morning routines. How old are the children? So that we need to know. Okay. Very small 4-year-old means, we need to be a little bit lenient. If it is going to be like 10 years, or 8, 9 years, they are a little bit older children, they are responsible, right? With them, we can go a little stricter. So first and foremost, um, morning routines. So we know, what time they need to get up, and then they need to go to school. Most of the children, they need to go to school. So for that, at least like an hour or like 45 minutes before that, they need to get up from bed. So you can make it easier by doing things in the night before they go to bed. Right. Okay. So they can finish their homework and then keep the all that ready, and even whatever the dress they are going to wear, all that also you can keep in the night before. That way, once they get up, and then so they can get ready and go. And also, okay, you need to, like, same way as I said. So when they are in a listening mood, they are not getting up means you cannot beat them, you cannot scream at them. So in the night or whenever they are like calm in the listening mood, or during like dinner time, everybody are in the same, like, dining table. That time you need to say, it is good to go to school in time. So we need to get up early. So early bed, early getting up, like that, some good routine. And then follow sleep hygiene. So make them sleep early. And another thing for that, even for us, we need to calm our mind before we go to sleep. So like the iPad, iPhone, TV, things which stimulate our brains, right? That at least 2 hours before bedtime, or at least one hour before bedtime, we need to shut it down. And then in a nice, comfortable bed, and a clean, comfortable bed, and then minimum light. So that way they will be able to sleep well. So, and you can tell like a routine, if you time permits, you can have like a storytelling time, like 10 minutes you can talk, tell some stories, good things. That time also like giving them good advice like that so that they will sleep well. And then in the morning, wake them up in a nicer way. Don't yell at them. Let them start their night, let them start their day in a like a happy mood, right? Be happy, come on, my dear, get up like that. And it is going to be like not in one day. So slowly, slowly they will get into it. So bedtime routine, so it is connected, bedtime routines and then morning routines, connected. And also don't have like 10 things at a time. One thing to start with, right? So one thing to start with, keep doing it. And then so like that, by routine, everything will come in place. And be lenient weekend or when they are they don't have school, leave them alone. They can sleep as long as they like to. So that way, so during the school time, whenever you want them to get up early, they will get up early. So a little bit older children, I said like 8 years and all, you can give them their responsibilities. Tell them, tell them in a nicer way. So you need to have the responsibility. What is the reason for that and all? That way they will be able to listen. So we need to be patient same way. We need to be share patience and need to have patience. And then we need to be like role modeling with them, talk to them in a nicer way. And then routine, try to keep the routine one after the other. So I think this will, it's hard, but it is doable. It is doable. Okay. Then fussy eaters. So again, number one, in the baby, a baby, right? So first 6 months of age, it is mainly breast milk or the formula. The baby takes only this, breast milk or the formula. Then later on, around 6 months, the baby, what it does is, so we'll be watching everyone eating means the baby will chew. So then that means, the baby is ready to eat. So at that time, we need to introduce solids. And when you introduce solids, one solid at a time, soft and things like that. And this time, whatever you give, the child will eat. Okay, whatever. So this time, you need to introduce more different foods, especially fruits, vegetables, all that. At this time you need to introduce slow and steady, one new food at a time. Keep doing that for one full week. And then if there is no allergy, no side effects, the baby is tolerating well, then you can introduce the next food. But whatever the baby has already eaten and fine with that food you can introduce anytime. Like that, different food you introduce, the baby will not reject and then will be eating those food. And introduction of fruits and vegetables earlier days, their taste buds will develop for those food, and so there will not be any problem later on in their life eating those food. So if we leave that gap, that time we are not introducing different food, then later on around like 10 months, 10, 11 months, 1 year, like that, it is whatever you introduce, they don't want to eat. They will be throwing it out. They will spit out. They don't like it. That time it's very difficult. Then you need to try, keep on trying 10 times like that. Keep on trying to introduce. So earlier you introduce different food, then it'll be easier. And also, there are some disorders, say some children, they have like mild autistic children like that, the food, color, consistency, texture, all that. They don't like, different food, texture, color, all those things they don't like. So in that, slowly you can get advice. And there are like um, eating, what to say. So we can send to them to the therapist, counselors like that, and then they will try to help the child. They introduce one food at a time, and slowly they will, cut down that barrier, and the child will be eating. Okay, so that is the best way. And one more thing I really want to tell about fussy eaters. So yeah, the child is not eating, then they give, as I said, first 6 months, milk is very essential, mainly breast milk, otherwise formula. Then in the first 1 year, slowly, we are introducing other food, and then the milk intake will be coming down. So by 1 year of age, the baby needs to eat breakfast, lunch, dinner, and then little bit of like snacks in between. And milk consumption should be like 16 to 24 ounces. By 1 year, after 1 year, the child will drink, maximum 2 bottles. One bottle is about 8 ounces. So 16, maximum 24 ounces, not more than that. Sometimes, okay, the child is not eating, give milk. So the milk makes the child full, and then the child does not have any initiative to eat other food. And okay, so the child drinks milk and then doesn't eat lunch. And then, okay, oh my God, from the morning, the child did not eat anything. Let us give another bottle, or let us give another glass of milk. So the child is drinking milk, and then again, the child does not have any initiative to eat food. So milk intake slowly, we need to curtail. Early morning, the child gets up, and then you give like 8 ounces. Instead of giving 8 ounces, you can give 4 ounces. That way, then after half an hour or 45 minutes, the child will be hungry and will be able to eat some food. Okay. And same way, storytelling, and then always, breakfast, when the mom is eating breakfast, put a high chair, make the child sit. And even if the child is like messing, it's all right. It's all right. The child is going to mess up. Okay. Make the child, eat with their own hands or with the spoon, like that. That way the child will learn. And then you keep on feeding them and they become lazy. Okay. So it takes more time for us. And then also, it's nice. Mommy is with me and feeding. So this is good. The child doesn't eat on its own. Keep somebody to feed the child, right? So it is all, routine. And then don't be angry, be patient, be nice, and need to introduce. Okay, so refusal to, that is about fussy, it is yeah, refusal to take responsibility, refusal to do chorus. So that also, like an 8 years, 9 years old child, you can tell, okay, so it is nice. You can make your bed by, don't give too many things. And then, so one, yeah, bring the plate and put it on the kitchen counter, like that, small things. So you can go take a drink water by yourself, like that. And so that way, yeah, you are a grown-up child. Always appreciation. As I said last time, appreciate if they do a good behavior, then you tell them, you reward them, you recognize that. And so that behavior the child will do repeatedly. That is human psychology, as I said. Definitely everybody like appreciation, right? So repeatedly they do the behaviors, the acts which bring them appreciation. So that and also reasoning them, be truthful to the children, and then tell them why you are asking them to participate. Okay, when somebody comes, you need to say assalamu alaikum, and like that. So good mannerism. And then also sit down and talk to them, other cousins and how you need to like share, in a storytelling way, yeah, all good qualities you can tell them, right? So that way, and reasoning it out why you are telling. So it is always good to be friendly with our cousins. So, they are our cousins, and see, they are our neighbors, so we need to be, and you can tell about the hadiths and things like that. That way, they will be able to uh, participate in those activities. Always patience, and then truthful to them, transparent, give the reason why you are asking them to do the things, then they will be able to do it. Okay, Dr. Najeeb.
Very nicely done. Yeah, I think so. You cover my topic too very nicely. Very nicely done. I think so. You hit the psychiatry very well as normal behavior very well. That is significantly important. But we have to go by the age group. As the kids are younger, they are immature, they are self-directed, means they want the world revolves around them, and you have to be very understanding, patience, and all those things. As a child grows up, you have to make them realize that is what we say, that the whole family exists. It's not all about you. That's a transition process at the age of 6, when you go out in a reasoning way, from symbolic reasoning to inductive reasoning, that uh, world revolves around you, but the family member is also important. So you need to appreciate the family member too, and that's comes at the age of 6 and 7, and that is a very significant time when the kid develops. I'm talking about a normal kid, a normal behavior kid. Yeah. So in that time, yeah, actually, empathy is the very significant portion, because they are narcissistic. In the first 6 year, the kid wants everything, and that's right. Kid has a right to have, but after the age of 6 and 7, they need to appreciate their brothers, sisters, the parents, and all those things, and that has to be incorporated in their behavior. It's not about you all the time. By the age of 10, if it's all about you all the time, there's something wrong the way you're training your kid. I'm talking about normal behavior person. I'm not talking about anybody who has mental health issues and all those things. That's totally different. So in psychiatry, what we say, the first 6 years is very important. The kid is focused on himself and the world revolves around. But after the age of 6 and 7, the symbolic reasoning goes to inductive reasoning, where you involve other people and appreciate them. And that is the time you need to introduce. Very important also is how the parents are modeling, how the parents are behaving, their demeanors and everything. They have to be very patient. Their goal has to be self-discipline, and delayed gratification should be kept in mind. Self-discipline is fine, but it has to be age related. A younger kid cannot be self-disciplined completely. They have their needs, they don't understand a lot of things, so you have to be very patient. But as the kid grows at the age of 7 8 and act like they are 4 or 5, there's a lack of self-discipline going on. So you need to be aware what age group you are trying to teach, and if they're lacking behind, and if they have a normal as everybody is, then we need to catch up. Is the modeling of the parents are okay, or we are entrapping them with our bad behavior? Especially helping them to dress up, helping them to eat, helping them to reach to school on time, helping them so many things which they can do themselves, but you don't want them to get late or eat less, or in the academics help them so that they get good grades, but they don't want to do, but you are doing it for them. So you're training them the wrong thing, correct? You have to let the responsibility go to the kid. As they grow up after 6 7 8, they need to catch up responsibility, they need to face the world. If they're late to school, they need to answer the school teacher or the principal, not the parents, correct? Because they were late, they woke up late, they were fussy about things. So once the kid realize they are responsible for their action, they keep on, then they get the point across that I cannot get out of it, because I cannot put a blame on my parents to do the solve the problem, because you're harboring and getting out of the problem by throwing back on the parents. And of course, at the age of 7 and 8, you should not be doing it. That's the time before you can get away, you're trying to help make them realize it, but then the time changes. As you have become 7, more than 6, the thinking in the brain changes, so you need to catch up with them and go from them. And I'm still saying this is normal behavior, not somebody who has anxiety, ADHD, autistic disorder, or learning disorder, all those things. Then that is different. So we need to be very careful about that. If we or somebody feels that they have some of those issues, they need to get help. So to identify as early as possible and get basically help as far as therapies are concerned or behavior techniques are concerned to help them. And the way that it's done in that scenario is totally different than normal scenario, because you have to be more patient, more accommodating, and they has to need more time, and that's how it goes. So you have to accept the diagnosis and accept how to work with them. It's a tough battle when you go into that area, but recognizing early is very important, especially for attention deficit disorder, because it's very common. And we in a community we realize that parents have a stigma against ADHD. They don't want to diagnose their kid because what will somebody will say about them, or also they think that it's better not to discuss. They will grow out of it. The research study have shown the other way around. Research studies have shown that 1/3 of them usually get better, and some of them get same, and few also can get worse too. So if you get treatment early, it's better for them to learn the way how it should be learned. So not to avoid those issues if they have to be diagnosed early and get the treatment. But if you have a normal kid with normal behavior, how you means how you're behaving with your kids is also important. If the parents are not behaving, means they're going to sleep late, they're eating not with with the kids, and they are not spending quality time with the kid, they're not educating and all those things, they're relying on the people, then there's a problem coming, because they are modeling with the parents. And if they don't see the parents much involved in it, and they're asking somebody else to take care of that issue, they learn, okay, it's okay to, I can bypass the system because my parents are not interested. So they're not learning, but the good learning comes from the parents or the grandparents. That's the idea. But if somebody else can help, that's good. But ideally, we should work on it. I know it's very difficult, but if somebody has to do it in a very nurturing, understanding way, and go from there. And it's a process. And I also recommend parents to read books on kids, the behavior development at the age of 6, 7, 8. There are books available where you can read how your child should normally behave at the age of 5, 6, even start from 1, 2, 3, 4, 5, 6, 7, 8. There's books available, short books available for each age group. So at least you're aware of it, what you expect from your kid, because we assume that what we did, our kid will do. The paradigm has changed totally. If you're thinking in that paradigm that what we have learned, they will learn, you're in the wrong era of living. The internet has changed, the way of lifestyles has changed, the whole surrounding has changed. It's not what we used to live in when we grew up. So we need to change. Like, if you don't know internet, I don't think so you can survive in current world, correct? 30, 40 years ago, it was fine. If you don't know how to use internet, that's fine. Now, so world has changed altogether. So same thing is how to understand human behavior is very important. And the more you learn early, the better it is for you, because prevention is the best treatment for everything. A lot of things can be prevented if you learn early and took appropriate action. So that will be my suggestion, very effective suggestion. That's why I assume that if you learn early, address that issue and cooperate with the kids and find the reason why they are not doing it. Maybe the kid has a good reason, right? So as long as you understand the kid's reason and have uh, on their level of thinking, start the talk and go up. In that way, they communicate well with you. They understand that my dad and mom understands me, because the point when you start talking and they get a feeling that they don't understand me, they don't understand my problem, then there's a communication gap, and that should not be there when you are with them. So there should not be any communication gap. You need to get to their level of thinking, understand why the problem is happening, what is the cause, and how I can help them to understand them and be empathetic and have completely compassionate with them and work with them and let them understand it's a difficult problem, but we can all both work together and solve it. And then tell about the reward phenomena. If you do this thing, this will happen. Your life, what will happen to you if you are able down the line, this will happen. So tell them the good part of it. Once they see the importance of doing it and achieving it, and seeing the results of it, from the parents, from the tone of voice and all those things, they start believing in it because they believe the parent first, right? If the relationship between the parents and the kids are strong, or relationship with the grandkids and the parents, and the kids are strong, they will believe in that because they are the primary source of first trust, correct? So you want to develop in the first trust a strong relationship, and they can see what they're going to achieve it, and then they will go for it. They have the instinct, they have a drive. You have to tap into that drive. Once you tap into that drive and you have a direction, they will go for it. As long as you figure out what are the impedance and where the resistance is. If you remove the resistance, give them a drive, they have the power. Allah has given the power to achieve that. And we should always look to our God to help us, and we'll go from there. Hopefully, I answer your question.
Yeah, Alhamdulillah, that's very beneficial knowledge from both pediatrician and from psychological point of view. I have one quick question, Dr. Najeeb. In general, why a normal child would refuse? As far as psychiatry point of view, what happens in their brain or thinking that they want to refuse their parents' request, the routines, or anything that they were assigned as a responsibility, they would refuse to do. So what happens in their brain?
Okay, so there's a lot of scenarios for that. The kids who are younger age want to enjoy their life, correct? And the parents are telling you, you need to wake up to go to school. There's a conflict comes in. Of course, they like to stay late in the bed, wake up, find something that interests them, correct? Going on internet, TV, and eating what they would really like to eat, correct? You give a healthy food, they don't like it. So there's a refusal coming, obstacle coming, correct? At a younger age group, they don't understand the importance of going to school, getting up early in the morning, things like that, correct? And it's difficult to understand, difficult to achieve that goal. But then, if you have given enough sleep, if they go back to sleep early at night, and so they have enough REM and non-REM sleep, so they are less resistant in the morning waking it up, correct? Because they meet all the sleeping requirements, so now they are more awake. Because in non-REM sleep, if you try to wake up, it will be difficult, right? In a REM sleep, when you have enough REM and they wake up in from REM, that's much easier to wake up. So anyhow, so you need to get up all the sleep as much as possible. And if they're eating well, healthy nutrition wise, so they are well nourished, so the body is ready for morning time. And you have to develop a routine, right? So if you have developed the routine, they will finally catch up with the routine. Other thing is what they see in the parents. If they see parents reading things, learning thing, how their demeanors is, and all those things, they try to imitate that thing, correct? Because that's the first source of learning. If that is not the environment, or parents are not present, or grandparents are not present, or somebody who they idealize is not present, so then they goes, okay, who is the next in line where I can learn from them? But ideally it should be parents or grandparents or somebody close by, so they can idealize it. Once they idealize, they like to follow what they idealize them. So that's very important for parents or grandparents to be there, or somebody who idealize them to be there consistently. If you are consistently there, then they'll look up for that. But if the consistency is not there, then they will have divided tension, that they will find ways out. They'll find excuses. oh, wow, that parent did do it, so I can do this. Because a kid always loves seeking, correct? They like to enjoy things, correct? So they will find reason how to get out of it. So you have to go at their level of thinking, which is hard. You have to have a very comfortable talk. Even if they have done really wrong things, you have to have a quality time. And that talk is very difficult for a parent because something they have broken or something they have said, you have to go into a neutral space with a neutral mind, with a neutral facial expression, body expression, and all those things, and make them comfortable that let's have a talk. I know you are upset or whatever happened. Let's talk and know about what happened. And they will throw their end of the story, and just, and listening is the most important part. And uh, don't cut it off. Let them speak to all the way. Once they speak most of the stuff and everything, and they are done with it, then step by step go back on their statement and try to dig up where they are covering the thing. The kid is very good in covering their things to make up what they are doing, and they are right. And you understand that kid wants to have fun. And he or she will try the level best to justify that they were doing right, correct? But you don't want to hurt their feeling, but in the meantime, you also want to correct them, correct? It's a very delicate balance, especially when they're young, correct? So you don't want to feel that, it's if they're very young and they broke, you don't need to be harsh on them because they're too young to understand, to take care of any delicate stuff, correct? And they will break things, and you have to be patient about that. But you have to redirect them that it will be dangerous if you break it. It will hurt you and hurts other things. So be careful. So you have a lot of patience is required, and the thing is communication, understanding, and go step by step. It's a long process. It's not a short process. I will say that.
Yeah,
And down
alhamdulillah.
the line,
Hmm.
yeah, go ahead.
Sorry. We have 2 minutes, so yeah, just to give you a heads up. Please continue.
So it's a long process. You have to be patient. You have to be goal directed, and with the blessing of Allah and God, we can do it. Everybody has done it. We will do it. As long as you have intention and drive to do it, they will do it too.
Thank you. That's excellent information. Dr. Habiba, any last moment? We have a couple minutes.
No, thank you so much. Yeah, he did really, Dr. Najeeb did very well. So explained very well. Thank you.
Thank you. So we thank both of our experts for their knowledge, for sharing to our community. May God Almighty bless them, bless their family. May God Almighty keep all of us in good health and good faith, so that we can absorb the knowledge from this expert and improve our life. Jazakallahu khairan for participating. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much for participating.
Thank you. Thank you.